Good evening to all of you. So today we will be starting with the aphorism 169. We have done till aphorism 168. So today we will be doing from aphorism 169 to 178, almost 10 aphorisms. The aphorisms are small, so we'll go by easily through them. Today we will start with the how to see the one-sided cases. There will be first the basic, like I have told you that when Dr. Hahnemann will go through these aphorisms, there will be one basic rule which will be going on there, and then there will be sub rules according to different kind of situations. But that basic rule, that basic part, the basic principle, that remains all through those things, those aphorisms or those guidings. So it will never be contradicted by any other aphorism. So that will always remain. As we go through more, we will go with it. So we'll start with the presentation. So aphorism 169. So we have been talking about that about the insufficient amount of remedies, and these aphorisms are concerned with that. But there will be some little things which I will take along with that when we will go through these 3 or 4 aphorisms. I will go one by one. If on the first examination of a disease and the first selection of a medicine, we should find that the totality of the symptoms of the disease would not be effectually covered by the disease elements of a single medicine. So Dr. Hahnemann is saying that when we have taken the case of the patient, when we have done the first examination of the disease, and now we are going to the selection of the medicines, and we find that one single medicine is not able to cover the whole totality. Okay, so there is some part which belongs to one medicine, some part of the case taking or the case belongs to some other medicines, owing to the insufficient number of known medicines. But this happens because there is insufficient number of known medicines. So again, in that scenario, not today, this will be a rare of the rarest events in today's case. If we talk about today, the number of medicines, the known power of the medicines we have. Okay, so what he told about that thing at that point of the time, but that 2 medicines contend for the preference in point of appropriateness, one of which is more homeopathically suitable for one part, the other for another part of the symptom of the disease. It is not advisable, after the employment of the more suitable of the 2 medicines, to administer the other without fresh examination, for the medicine that seemed to be their next best would not, under the change of circumstances that has in the meantime taken place, be suitable for the rest of the symptoms that then remain. So he's saying that you have a medicine which is more closer to one portion of the symptoms, then you have a second medicine which is closer to the other portion of the symptoms. So after you have given a more homeopathic remedy, means the one which covers more symptoms, once you have given that, it is not advisable to give the other remedy once that remedy, the earlier remedy has finished its work. It is not advisable, because he says that whenever an action of a medicine act, when a medicine acts and the action comes to the conclusion, when the action is basically comes to the end, then you have to take the case taking again. You have to examine it as a fresh case, see what symptoms are left, see what new symptoms have come in, like we discussed in the last aphorism also, conjoined all the symptoms, and then go for a new medicine which we have to prescribe. Because of the change of the circumstances, he uses the word the change of the circumstances, because there might be some accessory symptoms which have come, there might be some new disease symptoms which might have come, and then adding it to the rest of the symptoms, we have to go for a new medicines which might not be the other medicine which we have thought of before. So we have to see the case taking and the prescription. Prescription is all about following the steps. There are certain steps, there are certain basic rules which needs to be followed. When we say that we basically prescribed on the totality of the symptoms which are in present of us, and we prescribe a remedy which has a power to basically create those symptoms, to basically produce those symptoms. So when a medicine has acted on a patient, it has acted partially, like we have discussed in the last discussion when we had on the Organon about the aphorisms previous to this one, that when we talk about a partial acting medicine, so the partial acting medicine means that it will cure some symptoms and may produce some symptoms. In that case, some new symptoms might come which might go on their own or which may remain back there. So when we are talking about the totality of the symptoms, so now we have a different totality as compared to the previous examination. So we have to go on this new totality. We have to analyze these new symptoms, from where they have come, how they have come, and what are the characteristics of these new symptoms, and then come to the new remedy. In which case, consequently, a more appropriate homeopathic remedy must be selected in place of the second medicine for the set of symptoms as they appear on a new inspection. So the same thing, we have to find a second medicine which basically also apply to the set of the symptoms now which are appearing on our new inspection, on this new fresh examination. What are the symptoms remaining and what have been added to that? We have to see those symptoms and give a homeopathic remedy accordingly. Now here he uses the word change of circumstances. I will just like to add something to this, not from the Organon but from experience or from the things which I have read or gone through. Change of circumstances. For example, today I was discussing a case with one of my assistant doctors, that there is a boy who was not able to gain height and who was not able to gain weight. He had lack of appetite. He would have a weak stomach, gastric disturbances very easily. He will be prone to getting this diarrhea or vomiting after eating something which does not suit well with him. So after taking the whole case, we prescribed him calcarea phos, and he started doing well with the calcarea phos. He was a meek, timid child who would not speak, was very anxious and afraid of doing. So after the calcarea phos, when everything was going well, he started becoming more confident and he started gaining his height. He started gaining the weight also. Now he's appropriately at the height. He has gained the appropriate height according to his age. Weight is okay. The appetite is good. But from past few months, what I could see was that his disposition is changing. He is becoming more confident. He is becoming more outspoken. The father also says that he's become more angry and more obstinate as compared to before. So when I inquired with the father that was he like this, like when he was very small, like right now he's around 14 years old, 14 or 15 years old, I think. So I asked that so the father told that when he was 6 or 7 years old, he was like this, like he was a very obstinate and cranky child up to the age of 8 or 9 years. And then his mother, she died. And after that, he became a very fearful and afraid children, and very this child who will not speak with anyone, who was afraid of father, who was afraid of the strangers, who was afraid of his teachers and friends. He would cry. Okay. So he changed at that time. So this change of the circumstances, many times, because I get this question a lot of time, that when you prescribe a constitutional remedy, is this the remedy for whole of his life? Like whenever he gets under some kind of problem, you can give that remedy, or when the cure is going on, you just stick to that remedy? It may be not. Many times there are very strong circumstances, the change of circumstances, which might change the disposition of the person. which might even change the course of the disease. For example, if this child was suffering from a set of symptoms from past 8 or 9 years, suddenly after such kind of event, the whole set of symptoms changes. For example, this child, if he was suffering from this bad tonsillitis or tendency for cold and cough, after such kind of incidents, the whole symptom will change to some gastric disturbances. That set is completely gone, and a new set has come where the child is not gaining weight, he's not eating properly, he's having gastric symptoms, he is having some mental symptoms which are of fear, of insecurity, and all those things. He's not the same child. So when you prescribe the remedy and he goes back to that place, again at that place you will see that you will need a new remedy, because a new set of symptoms have come, a new kind of disposition have developed, which was not there when you prescribed the first medicine, and you will need a new remedy. So right now, according to whatever his symptoms are, we prescribed him lycopodium. But the main thing to understand is that this change of circumstances can basically change or produce new kind of symptoms, or produce a completely new kind of set of symptoms, a new kind of disposition also. So yes, in some cases the constitutional remedy can remain the same where this kind of change has not happened, but in some cases there might be change which had been there before. It might come up and you need to change your medicine accordingly. So this is just a piece from my side. This is not related to this aphorism or the further aphorisms, because this was recently discussed and I thought it is important to share it with you. So aphorism 170. Hence, in this case, as in every case, where a change of morbid state has occurred, the remaining set of symptoms now present must be inquired into. So whatever the remaining set of symptoms we have after this kind of prescription which we have made, where we had not a perfectly simillimum remedy because of the lack of the knowledge of the medicines, because of the, in his case, lack of the medicines. He had few medicines. In our case, lack of the knowledge of the medicines. So without paying any attention to the medicine which at first appeared to be the next in point of suitableness, another homeopathic medicine as appropriate as possible to the new state now before us must be selected. So now what we have to do is that we have to see this new state. Some part of the whole state is gone, but some part of the disease or the set of symptoms is left with us. So this symptoms or some additional symptoms, whatever the state is in before us, we have to see that thing and we have to choose a homeopathic medicine which is appropriate to this state without paying attention to the other medicine which we have thought earlier. Many times what happens is this is again, we have to take it as a caution. I had been doing this thing. So from my personal experience, sometimes I wasted my time in this thing. In this thing means when you are going for this, your the first case taking is done, you have some remedies in your mind. In my case, I would write few remedies, that these are the remedies which I thought about, and why one of the is more appropriate is because it contains this particular part or this characteristic, and I think that this is the more appropriate remedy. So I would prescribe it. If it seems to be partial, if it comes out to be partial, I will go to the second remedy or third. So that is a wrong way. Whenever you have to change the remedy, think of the case as a new one. Like recently, because after this kind of experience, I came with an exercise for myself and I found it useful, and I told in the last workshop also in the camp in the Thailand, that when some certain set of symptoms are not working with you, like they are not giving you some medicine, you have a picture of a patient in your mind that he is this thing, like for example, he's a responsible person, he has gastric issues, he is sensitive to cold, he is hot or thirstless, and this is the remedy which I have to prescribe. Next time, if the medicine does not work properly, don't go again with those set of symptoms. Those set of symptoms did not work for you for the first time. They are not going to work for you the next time. Go with something new. Try to find more characteristic symptom. When we select a partial remedy, partial simillimum, that just only means that we have seen the case very superficially. We need to go more deeper into the case. That is the only thing which we need to understand from that kind of follow-up. That we need to go more deep into the case. We need to find a proper remedy. With all that knowledge which we have to always try that we need to find a proper remedy. That's it. If it should so happen, as is not often the case, that the medicine which at first appeared, so he's saying that if it happens, it does not oftenly happen, it does not happen very frequently, but if it so happens that the medicine which at first appeared to be the next best seems still to be well adapted for the morbid state that remains, so much the more still it merit our confidence and deserve to be employed in preference to another. So after taking the another examination, if in that case the other remedy, the second remedy, which was less homeopathic in the case, it seems to still merit in this new examination, we find it that no, it covers all the symptoms, and even the new symptoms, they are come under the this the whole array of the symptom, they basically fall into this remedy, then we will be more confident in our prescription, and then that is the medicine which should be given to the patient. But he gives a caution that it does not oftenly happens, because when a new symptoms come up, or some of the old symptoms are characteristic, they are gone, then most of the time it happens is that that remedy does not seem to be the right one. So the thing is, whether it is the right one, whether it is not the right one, that can only be uh, understood if we take the whole case again, if we take a new examination every time when we are left with the symptoms. So in non-venereal chronic diseases, those therefore that arise from psora, we often require, in order to effect a cure, to give several anti-psoric remedies in succession. So in chronic diseases which are not basically of venereal infection, means basically of psoric origin, they are not of psychotic or syphilitic origin. So in those cases, he is saying that in many cases we might need anti-psoric remedies. We often require anti-psoric remedies, several anti-psoric remedies in succession. Now, there is some doctor who basically advocates that this aphorism. He will just show this aphorism that, see, in 171, Dr. Hahnemann has said that we will need several anti-psoric remedies in succession. And because we have not read the aphorisms before that, we also, after seeing that, we also come to that conclusion, or it basically sets in our mind that it is okay to give medicines like that, on partial symptoms, on first cure this symptom, then cure these symptoms, then cure that symptom, then cure that symptom. This is strictly about that time where he has mentioned again and again in every aphorism of his, okay, that I don't have much tools with me right now in the form of medicines. It will not be for the for the future. This thing is not for the future, when you will have a lot of remedies and they are well proven and you know about it. There are a lot of materia medicas telling about those medicines. So this thing is basically because of the time that he did not, because he was the only person who was doing it at that time. He was the only person who was proving the medicines and writing down the effects of that, along with that seeing the patients, along with that writing the book, and he was not a person that just from one or two provings he will write down the materia medica. No, he was a very, very thorough person. The remedies, you will be very many of you doctors who have read about these journals or the informations given by Dr. Herring or Dr. Kent, many of you might be knowing, but I am just telling that the remedies which Dr. Hahnemann proved, when the later on the same remedies were proved, the doctors, they were very surprised to see that there were no more peculiar or characteristic symptoms to add to those provings. They could not add anything to that. Even a remedy like euphorbium, we have very less thought about it. It is given in the chronic diseases. It is one of the antisorics. That remedy was so well proven by him that no one can even add to that remedy after that. And you can check with the provings and the materia medica afterwards. There is nothing new which is added to that thing. So he was a person who was very thorough. He would not publish anything. He would not write about anything until and unless he was 200% sure about that thing. And we can see through his whole literature, when we go through that, how thorough that man was. So he will not write this kind of aphorism without a context to it. So reading this aphorism 171 without context to it, then it may appear, okay, we can give, many remedies in succession. So that is why many homeopathy, okay, after this give this remedy, after this give this remedy, after this give this remedy. That is not a succession which he is talking about. Every time he has told us that take a fresh examination and then see. These aphorisms we can use in our prescription when we are partially prescribing, means we have not intentionally but accidentally prescribed partially because of our knowledge, because of our less understanding of the case and the materia medica. Then we can use this information. This information is very important, how to deal with those cases, because these things happen. New symptoms come up, old symptoms, certain are removed and certain are there. But in his case, the partial simillimum was going because of the few medicines. In our case, the partial simillimums are going because of our less knowledge. So for that, we have to increase our knowledge and see this thing in a very observant manner where we are doing wrong in such cases. Yeah. So several antisoric remedies in succession, every successive one being homeopathically chosen in consonance with the group of symptoms remaining after the expiry of the action of previous remedy. And everyone should be chosen homeopathically in consonance. Okay, it should be homeopathically similar to the group of the symptoms which are remaining after the expiry of the action of the previous remedy. When the previous remedy, its action has expired, it has ended, then whatever the remaining symptoms are, they should be seen, and an antisoric must be given for that, which may have been employed in a single dose or in several successive doses. The previous remedy, it might have been employed singly or many successive doses. It does not matter, but what matters is that whenever the action of a remedy, it basically ends, then we have to make a new examination of symptoms and then prescribe accordingly. A similar difficulty, the similar part, now this is not owing to the less amount of medicines, but too few symptoms. Okay, in those cases, so we will come to that part. From here, the one-sided diseases, they will start. A similar difficulty in the way of the cure occurs from the symptoms of the disease being too few. When we have very few symptoms, a circumstance that deserves our careful attention, for by its removal almost all the difficulties that can lie in the way of this most perfect of all possible modes of treatment, except that its apparatus of known homeopathic medicine is still incomplete. He reminds again and again that the apparatus of known homeopathic medicines, the homeopathic medicines which which he knew at his time, it is not complete, are removed. So he's saying now the similar difficulty that I have few medicines, but then there are symptoms which are not covered by these medicines which I have. So there is a similar difficulty in that part also, that when the symptoms are very few symptoms are there, so there also we have to see very attentively, and our difficulties can lie in the most perfect of all possible modes of treatment are removed. So they can be removed if we can just carefully be attentive to the symptoms which are present, try to understand them, what they are, and try to find the characteristic. He will talk about that. The only diseases that seem to have but few symptoms and on that account to be less amenable to cure are those which may be termed one-sided. So he termed these diseases to be one-sided diseases. One-sided means that they basically display their whole in just one or two principal symptoms, very few principal symptoms, because they display only one or two principal symptoms which obscure almost all the others. So there are only one or two principal symptoms which in the coming aphorisms he will say that, but they will be violent. There will be symptoms which will be violent or principal that they obscure, they just suppress all the other symptoms and they show themselves. They belong chiefly to the class of chronic diseases, and they also belong to the class of chronic diseases. Like I had told about a case, and I have shown also that case of a man who had chorea, and in the chorea there was this jerking, the jerking chorea. He that was also this kind of case. There was no other symptom, no other problems, no pains of any kind. I because before giving a rare remedy, I am always very, in a manner very careful, or you can say cautious or fearful also, that I am not a big fan of giving rare remedies, the remedies which are not, which don't have a great deal of symptoms. So in that case also, I was not in favor of giving that remedy, but there was nothing else. There was nothing else. I tried a lot to find some characteristic symptoms in his mental picture also, in his physical picture also, in his journals also, everything in his pathology also. But there was nothing else. So those are the one-sided cases where you don't have any other symptom. But one or two symptoms, like also there was this girl who suddenly went into unconsciousness, and in her unconsciousness she was constantly scratching herself, scratching her very badly. Her eyes are closed, like this, and she's scratching herself. What happened? No one knows. She suddenly went into this thing. No one can tell what happened. So we didn't had a causation, because causation was there with the patient only, and she was not in a state to tell. So we just had this one symptom of this, brutally scratching herself, and I gave her belladonna. Just I rubbed the belladonna around her lips, and I think within 10 to 12 seconds, I'm not even talking about a minute, just 10 to 12 or 15 seconds, she came back to her consciousness, and she was sitting and asking what happened to me. So because in those cases where these one symptom or two, that is the only way at that time the disease can show itself. So they will be very characteristic, very peculiar, and very outstandingly being shown, because they display only one or two principal symptoms which obscure almost all the others. They belong chiefly to the class of chronic diseases. Their principal symptom may be either an internal complaint. So this principal symptom might be, for example, some internal complaint like a headache of many years duration, a diarrhea of long standing, or an ancient cardialgia, some pain in the heart, or it may be an affection more of an external kind, or it can be on the surface like on the skin. Diseases of later character are generally distinguished by the name of local maladies. So the diseases of this kind, one-sided disease, which come on the physical part, on the skin part, they are known as the local maladies or local diseases. So he will be discussing those later on. In one-sided disease of the first kind, it is often to be attributed to the medical observer's want of discernment, that he does not fully discover the symptoms actually present. So again, the the same thing which I was just talking about some time before, when I told you that I am very cautious about giving such remedies. So I have to go through. So the same thing is that many times we may think, for example, if the patient is not giving the information, or sometimes the physician is not into that state where he wants to ask something more, because of our nature also. Sometimes if a physician is more reserved, more timid in asking some things, and he's not conveying his questions properly to the patient, or his message to the patient, so he might not be coming up with the whole information. So he says that in that case it appears to be one sided, but it is because of the medical observers want of discernment, lack of that initiation, or lack of that the way to get out the symptoms. Because in those cases symptoms are there, but the patient sometimes he does not, or she does not understand how to reply to our questions, or sometimes they're skeptical that why we are asking so many questions, or sometimes they don't even understand what is the purpose of this thing. So we have to make them understand that in homeopathy it is necessary to find such kind of symptoms, or go to more depth, so that we can come up with the medicine which can be accurate and be given, so that the patient can get cured. We have to educate the patient, because many of the patients, they are coming to homeopathy, or the real kind of homeopathy, for first time, where they are giving a case of their the whole history is being asked, the whole of the symptoms are being asked. Today I had a case. I prescribed him 10 days back. He was having this problem of diarrhea from past 1 month. He was taking antibiotics, not getting better, so he came 10 days back. I prescribed him the remedy, he was better. So today he came, and then I started asking him more, that okay, tell me. So he was like, okay, no, don't give me the medicine for these symptoms. It is okay. I can bear with that. So I had to educate him that you can bear it with that, or you don't want me to concentrate on them. It is okay, but they all are interrelated, and to find a better medicine, I have to ask about them, because sometimes the information to finding a remedy may be present there in those symptoms which you are having, which might not be of importance to you, but they might be of importance to me in finding my remedy. So in that way, we have to sometimes educate the patient also about the necessity of a case taking. So from that part, we can then come to this thing that okay, this was not a one-sided disease. There were symptoms, the patient was not telling us, or we were not going deep enough, or we were not understanding the patient in a more deeper manner, so that we can come out with these symptoms. So not fully discover the symptoms actually present, which would enable him to complete the sketch of the portrait of the disease. So there, in that part, we have to go with more patience and more time, give the case more time, give the patient more time, so that he can come up with those symptoms. There are, however, still a few diseases which, after the most careful initial examination, present but one or two severe violent symptoms. Now he used the word violent symptoms, while all the others are but indistinctly perceptible. So he said that, but still there are few cases when you have done a very careful examination, when you have asked about everything, and still you are not able to come up with anything. So these two or one severe violent symptoms which are present there, they are the only symptoms which you have to prescribe upon. In order to meet more successfully such a case as this, which is of very rare occurrence, we are in the first place to select, guided by these few symptoms, the medicine which in our judgment is the most homeopathically indicated. So like I told you in that case of that jerking chorea, I have to give him, I think, teucrium. We prescribed him teucrium, I think, because that was the only remedy which covered that thing. And next aphorism came true to me after prescribing that medicine. Although I knew about this, but for me, it came, like I told you, that these words will become truth for you when they will happen in your experience. They are true according to Dr. Hahnemann's knowledge. He has written it, no doubt in that. But to become truth for you, because there are some things which happen in front of you, and then they give you confidence and conviction in what you are doing. So after prescribing him teucrium, he came to be a completely normal person. He was like that, I even don't know if I had chorea. I had this kind of problem. So it will no doubt sometimes happen that this medicine, so sometimes happen that when the medicine is given, selected in strict observance of the homeopathic law, because we have selected the medicine in a strict observance of the homeopathic law, we have not deviated from that law, that basic law of similia similibus currenter. I have found a remedy which was very similar to that violent symptom in both the cases, the belladonna also and teucrium also. So it was strictly in observance with that thing. So what happened was, furnishes the similar artificial disease suited for the annihilation of the malady present. So he said that it basically produces the similar artificial disease, and the malady present, the natural disease present, is basically annihilated and cured. And this is much more likely to happen when these few morbid symptoms are of very striking, decided, uncommon, and peculiarly distinctive characteristic. And it will happen more oftenly if the symptoms which you are seeing, those one or two symptoms, are very uncommon, very peculiar, and very distinctive. And in both the cases, why these cases have produced, a kind of this posted a stamp in the mind or the memory, because in both the cases the symptoms were very strikingly peculiar. We have seen many chorea cases, but not that kind of chorea. That was a characteristic of that disease which was being shown. That was a characteristic of that patient which was being shown when she was, scratching so violently herself. You have read about that violence of the belladonna, of that suddenness of the belladonna. Suddenly she fainted and she was in this state. So in those cases, in those kind of one-sided diseases where you just have one or two symptoms, but they are of violent character and they are very striking, very uncommon, and very peculiar. And then third case also, which I have told, I think last time, about this tuberculinum girl, when she had this attack of migraine, when she had this attack of headache, she would, very very hardly she would bang her head in the wall. Only that way she would get somewhat of relief, not by pressing it, not by applying anything, but just banging her head in the wall. And she got cured with tuberculinum because it had that kind of uncommon, peculiarly striking symptom. So this is about the one-sided diseases. The one-sided disease where we have very few symptoms, only one or two violent symptoms, and we have to prescribe on that. We should not misjudge a case who have a proper symptom, but because of the patient or because of our knowledge, we are not able to bring out the symptoms. So those symptoms should not be considered as one-sided. Those are not one-sided. There is ample amount of characteristic symptoms present there, some kind of sensitizations which are present there, but we are not able to get that because of some obstacle in our this case taking part. So we have to remove that thing. We have to make patient more comfortable. We have to guide them. We have to tell them about the importance of this thing and why it is important to cure them. So with that, uh, we will be talking about from aphorism 179 onwards in our next discussion on next Wednesday. So any questions if you have, you can send me about, because now we are going through this practical part of the case taking, Organon. So this is very important to know the different circumstances in which the patients come, different kind of diseases, different kind of diseases, different kind of observations which we can do in these kind of cases, what we have to keep in mind, what to do, what not to do, because on every important turning point in the Organon, Dr. Hahnemann has advised a caution that do not do this. So we have to be keep that thing in mind, that do not do this. Like I told you today, that don't think about the old remedy when you are thinking about the next prescription. Don't do that. You will be wasting the time. Okay, just go for a new examination, try to see what medicine comes up and give that medicine. Just keep it simple. Don't Organon is very simple, homeopathy is very simple. It is based on very simple laws. A laws, if I make some, I we can make a layman who does not have any medical practice, who does not have any medical knowledge, and you just tell him about these laws. You just explain him this thing, and he will say, yes, it makes some sense. It makes some sense. Because this has been seen by everyone, this has been experienced by everyone. So homeopathy is very simple. We does not need to complicate it. We does not need to do something which can make our lives or homeopath's life more difficult. So just we will just keep it simple. Simple laws, simple things, okay, simple reminders, simple cautions, with what we can do, what we should not do. So just keeping that thing in mind, we will just, if we keep practicing, we are sure to get the results. We will surely get the results. And the more I get response from some of my students and the doctors which I have talked with from this, from whenever I have started, I have seen that the more they have kept their this clinical part simple, they have get more results out of it. They have sticked to these guidances. They have stick to the organ. They have stick to the simple ways of learning materia medica, understanding it more deeply, and they are getting very good results in all kind of cases. So just we just need to follow just once. We don't have nothing to lose, maybe something to gain, but nothing to lose if we follow whatever advices Dr. Hahnemann is giving us in the Organon. So we will just try to follow them and see what comes to us. So with that, I will take your leave. I will again advise you that you go through these aphorisms in the coming week. If there is any kind of difficulty, if you find something which is confusing or something which you find it, you can ask the question on the group. You can send the question personally to me also, or to Dr. Jonkol, and we will take up that question in the next part. So with that,